Good afternoon, everyone. So we're going to be presenting on this application that we built. Since the beginning of 2015, there have been 34 new data sets published on the Open Data Portal and about 6,000 views of those data sets. And that might sound like a lot until you consider that it accounts for only about 7% of the total views. Right now, there are 87 data sets in the portal, and half of those total views are of only 10 data sets.
And this is why we've built an application that automatically looks at every single data set on the CHHS Open Data Portal once a day and posts the name of each new or updated data set to Twitter with a direct link to that data set. It is currently live, so you can follow us on CHHS Portal News.
The reason why we chose this approach to use the metadata of the entire portal is because the state and supporting foundations such as CHCF are investing massive resources into publishing data onto this portal, and it is subject matter experts that guide interventions to improve health outcomes. They could make the best use of this data, and we want to deliver it to them.
So the goal for this app is to increase the number of people who know about these data sets. By automatically delivering this data to exponentially more people through social media, subject matter experts can be aware of what CHHS is publishing and when. They can easily find, share, and analyze the data sets that are most relevant to them.
We chose Twitter as a starting point because it is a robust, established platform with an established user base and a user-friendly interface. We also chose it because it is feasible for entry-level technologists to deploy it in under a day, and it is completely free.
So what comes next? We're developing the second version of our app that looks for California health-related hashtags on Twitter. And in each tweet that links to an updated or newly published data set, we'll include one of these hashtags. This way, we can organically grow the number of people who know about these data sets and are interested in using them. We're also working on automatically posting updates on other social media sites like Facebook and Tumblr, which is easy to do with their APIs.
We've both been involved with Code for Sacramento for over a year, and open source is very important to us. Therefore, the GitHub repository of our source code will be made public within the week. This means anybody will be able to fork it and modify it to track any Sac-Code-A portal and deploy it in under a day. We also welcome and encourage contributions to make it better.
We believe our solution is automated for consistency, is easily sustainable at minimal or no cost, and able to impact the most people. Thank you. So, questions? Yes, Andy.
Okay, so I'm just curious. It makes sense to go with Twitter and, like you said, perhaps Facebook and Tumblr going forward. Have you thought about low-tech email kind of blasting solution as well? I mean, that may be harder to build, but...
So the great thing about the way that we've written the application is with Python libraries, they're completely extensible. And so there's application stacks that are already out there, such as Twilio, that can handle email or even doing things as direct as for people who have indicated interest to be able to send them text messages if they are keying in on keywords that are tags for us. And so that's why we're hoping to promote the use of more specific and relevant tags when we upload the data sets to the portal, and making sure that we have specific hashtags that will be high activity and able to identify those target populations that we want to reach out to.
Thank you.
Yes?
Did you, I'm sorry if I missed it in your opening list, did you identify how frequently the data sets are updated?
Yes, so the metadata is actually updated every hour. The reason why that we pull the data once every day is because the granularity on the metadata for creation date and modified date is on a daily level. And so by doing this, we're able to identify the data sets that are completely new by looking at the date that they're created and the date they're modified, and for data sets that are updated with different creation and modified dates within, by comparing that to today's date.
And did you test it to see how many notices it would have generated for change?
Yes, so the average that we have seen is anywhere between 3 and 6 data sets per day, so it won't be an overwhelming amount of tweets and information being sent out, and we'll avoid spamming people as well. We definitely consider that. Thank you for your question.
Any others? All right, thanks. Okay.
Dr. Angela Walker, and I'm actually a clinician who practices medicine in the underserved communities of the Central Valley. We're proposing a by-proxy provider referral network, building an ECHO map. I came here with a problem. My problem is that there's costly care, it's not optimal, and there's a care gap in the underserved communities of the Central Valley. This is a graph that shows ED visits per 10,000 population for each of the counties in California. I've highlighted the first, third, and fifth column that shows the number of providers per 10,000 patient population. You can see a median number of physicians in a 10,000 patient population of 15, with a range between 0 and 37. You can definitely see with providers of 7.5, 8.2, and 8, there's not a large number of providers in the Central Valley communities. We're proposing a solution called ECHO Geolocation. ECHO is a program that tries to capitalize on the providers who are in a local region by providing them with specialty services training, so they can then provide some asthma education and asthma services, though they may not be a pulmonologist or have specialty training in the treatment of asthma. To do this, we need to mine the data. We've designed a web platform where we can enter our search criteria, including a proxy code and zip code. We chose to use a proxy code because it wouldn't be effective to search for specialists if we already know the specialists aren't there. The proxy code we want to use is either a diagnosis code or CPT codes for services that would be provided to patients with asthma. You can imagine use of a nebulized treatment, perhaps spirometry, things that would be indicated in the care of an asthma patient. We can then submit a query to identify what local providers in that community already serve the underserved communities and perform these services. And then a provider referral can be initiated. We can provide back-end metrics to ECHO, so we can show them which providers may be benefiting from ECHO training to provide these services. And lastly, we'd like to make an ECHO geolocation map, so that other providers can service and see which providers local to their patient population may be able to be treated locally. The benefits of this system for patients is access to health care. For providers, it's an ease of referral use, especially in our growing telehealth communities, and also opportunity for education, developing an expertise in a certain disease. The healthcare system benefits by filling a shortage gap, increased care quality, and we'd like to extend this to the future to maybe integrate into electronic medical records and also other disease populations.
Here is a short demo just to see what a doctor will see when he's trying to use the system. So it's just a mock-up, it's not a complete operation system. First, a zip code will be entered, and then the condition will be selected.
We may finish there for the stop time.
Yeah, we're at the stop.
Any questions? Yes.
Which of the CHHS data sets do you use? I assume you're using asthma as well.
Yeah, we used a couple.
But do you have provider data you can access as well?
Through the California Healthcare Foundation, we were able to access provider data. And then by billing code, we used CMS data sets that showed who was billing for what.
Thank you.
Actually, we are looking for Medicare cost data to be released just like CMS is doing right now. That would help our application a lot.
Thank you.
Any other questions? Great, thank you guys very much.
Good afternoon. My name is Adnan, and my teammates are Mac and Rocky. Yesterday, when we got together, Ms. Mary Holiday Hansen talked about the Let's Get Healthy California initiative, and she hinted that there was a need for a dashboard. We went on and looked at the task force report that was published online and found that in the report it mentions a dashboard ideally would promote information sharing, facilitate collaboration, facilitated collaboration between facilitated collaboration among the community and drive effective decision making. So over the weekend, we decided to target that scenario and try to build that experience. So I'll go into the demo. First, you have a dashboard, and here you see 5 of the key indicators from the LGHC initiative. These were the 5 indicators that are available in the data sets available in the California Health and Human Services open portal today. You could add all the other indicators as they come online to this dashboard. From this view, you can click on one of these charts. So let's say I want to go into the asthma emergency permanent visits. And here you see Sacramento County compared to the other counties. This system is assuming that we're logged in as Sacramento County, and it's finding other counties in the same region and comparing them to Sacramento. The blue line represents the target set by the task force report, and each of the bars represent other counties. You can also switch to looking at counties by population size that are similar to Sacramento County. You can also compare Sacramento to 5 counties that are doing the best towards the goal. So once you have, so this allows the policymakers who are strapped for resources and are not often very technical to quickly find very accurate information about the county that they care about. Once you have that information, then it's all about discussion. You can discuss with each other how the performance is going. So Matt can select, as he switches the charts, you can see the contacts information for those counties specifically coming up, and you can contact those people directly. So here Rocky and Matt will have a very simple conversation around the chart. So basically what policy does, it gives a very simple, easy way for county and state policymakers to look at their data, discuss it, and share it with each other to drive change. That's it.
So the choices for search were counties, and then how many different conditions?
No, so these were, we picked out the 5 indicators that are available in the portal today out of the 39. So the idea is that you'll have a dashboard with 39 charts, 1 for each indicator on a state level. And when you click on one of them, you'll see county level comparison for each one of those indicators.
What would you envision, given that there's 39 indicators, the higher level view that gets you to, the specific indicator? Maybe you guys didn't build that out, but I'm just thinking about. So
you have the 39 indicators. Right?
Yeah. So you have the 39 indicators. How do you start from the 39 to get you to this particular one?
Oh, so if you go back to the dashboard, the idea is that all 39 will be there. And we're working on a search that will allow you to quickly type in like I care about asthma, and it will just filter down to the specific chart for just that indicator. Because if you have 39 tiles, that's not very easy to understand your point. But for 5, this wasn't good enough layout. The questions?
What's your team name?
Policy, Polise.